think they'd all be experts on by now, but we're finding out the 10 things men don't know about their penis that can make all the difference in your man's health from the author of The Hardness Factor, Dr. Stephen Lamm. Now, parents, you should get your kids out of the room because what we're going to talk about should be for adult ears only. Joy, say nothing during this segment. This is a very serious medical topic, so we're going to start with the first thing. Erectile dysfunction can lead to death. Please explain, Dr. Lamm.
Well, you know, first of all, I obviously applaud the view for tackling such a controversial subject, but the reality is, if you listen to what I'm trying to say to you, you could probably save your husband's life or your brother's life or maybe even your son's life. Erectile dysfunction is really the result of blood vessels that are not working. And the blood vessels to the penis are smaller than the blood vessels to the heart. So the penis may be the first organ that is injured. We've had many, many patients who've developed erectile dysfunction, have gone to the doctor, have been worked up, and their lives have been saved because their coronary arteries now did not have a heart attack.
So it's a sign of something that could be going on.
Right, so this is an issue that is certainly not a laughing matter for the man who's got it or their partner, but the reality is it's a sign. It's associated with high blood pressure, high cholesterol, smoking, obesity, sleep apnea, all these other conditions, so it's really not a laughing matter.
Okay. But at what point do you say, okay, this is not just, I'm not stressed, I'm not overworked, I really need to go see a doctor?
Very good question. Every man has had a failure, whether they're 20 or 30. What happens, erectile dysfunction, is the consistent inability to be able to perform when they really need to. So it's not an occasional failure. You know, the person's all of a sudden not really having an effect after 3 months, 4 months. It's time to go to the doctor. Don't be ashamed. Your life can be saved.
Okay. Let's move on to the second. Men have about 11 erections a day. What does it have to do with just typical health?
Right, erections are really just not about having sex. In other words, there's an erection center in the brain. There are nerves going down the spinal cords, and that explains why men wake up in the morning or throughout the night with maybe 4 or 5 erections. You can take advantage of that, by the way, but it's not sexual. It's during their dream state, and it's as a result of testosterone. That's how we test whether or not we think the man has a psychological erectile problem or a biological one. If he's waking up with erections, he's fine.
But so you're saying if a man doesn't have 11 erections a day, it's a problem?
Not 11. It's not about 11. It's, you know, you want to have irregular erections when you're waking up in the morning or sometime in the middle of the night. When men get up in the morning with an erection, it's not because they have to urinate. They have to urinate all day long. They don't have erections then. It's really due to dreaming and testosterone. So if you don't consistently have it, it's time to go to the doctor. Maybe diabetes or your testosterone can be checked. 40% of men 45 and older have low testosterone.
What if he's having, you know, like 3?
3 is great. Don't worry about counting. We're afraid. The guy's gonna.
I mean, men like to count
regular.
things.
No, don't start counting, gentlemen.
Okay. They're gonna get competitive over that.
One good one is fine. You see?
Moving on. Another fact is that you can actually fracture your penis.
Yeah, this even makes me cringe. It's not a, you know, look, it's not a bone, but actually during a sexual encounter, an erect penis is vulnerable, and it can actually, unfortunately, during some sexual acts, can bang up against the bone and actually fracture the ligament almost. It's connective tissue.
Like a cast?
No, you actually. You know, what happens is that it causes excruciating pain. It snaps, crackle, and pop. You need a surgical correction. And it only occurs with an erect penis. It never occurs with a flaccid penis. And here's the bad news. The men with the largest penises actually are at greater risk.
Oh, that's too bad.
That's too bad.
But you can't make a full...
Take note.
You can make a full recovery, but you need surgery. If you don't get it treated properly, you can develop then a whole bunch of problems, curvature of the penis, and problems in the urethra, which is the opening for urination.
Okay. How common is this curvature of the penis?
The
curvature, which is called peroneus, is very common. Actually, we're going to give you a website that people can go look at, which is very important, because this curvature then causes a bending and a weakness. It's a real issue. There are new methods now which help straighten it. Actually, we're going to give it to you on the website.
Like exercises to do?
Pilates.
There's actually a device which helps extend it. It's a company called FastSize, which actually can extend it, or you need surgery.
Okay. This is another fact. Rapid ejaculation is the #1 concern.
But the real term is called premature ejaculation. That's the #1 sexual complaint of young men, which means that they're basically ejaculating without any control. They're actually ejaculating even before they put their pants down. So this is a problem not only for them, but certainly for their partners. It occurs in younger men who are inexperienced and very anxious. It occurs in older men who actually have erectile dysfunction and want to get this thing over with because they're afraid.
Control it, though?
Well, they can't necessarily control it. They have to remember, orgasm is a learned response. It's only humans that actually try to delay it. In all the other species, you want to get in and get out quickly.
It's learned. What are you talking about?
It's a learned response. In other words, we learn to retard ejaculation. In other words, a dog doesn't say, "No, I want to go longer." In the animal kingdom, you're right. In the animal kingdom, you're very vulnerable during a sexual act. Actually, even in real life, you're vulnerable. But you want to get in and you want to get out quickly. But humans want to prolong this, so we've got to learn how to do this.
I see.
Okay.
Is it worth it to do the baseball scores?
It doesn't work. The Yankees this year really were a problem.
That doesn't work?
You can go to the doctor. There are medications you can take, and there are techniques that you can learn. Shouldn't be embarrassed by it. Go to the doctor if you have it, because it affects the quality of your life. It causes unbelievable anxiety in the man and certainly in their partner.
If I may, really quickly, what percentage of men suffer from problems?
Unbelievable number, at least 30 to 40%.
Okay.
So you're not alone if it happens.
You're definitely not alone.
Okay, and you're a great resource for this information, Doctor. Thank you. Our thanks to Dr. Lamm. Everyone in our audience is getting a copy of Dr. Lamm's book, so you can figure it all out.